Starting with the name of Allah, the most gracious and the most merciful. Today we are going to discuss four important topics, that is cannabis indica, salicylic acid or aspirin, zinc phosphate, and aluminum phosphate. Do remember, cannabis indica belongs to neurotoxins or neurotics, and the further neurotics is belong to the cerebral, and after that it belongs to the deliriant. Do remember this. Other than this, salicylic acids, zinc phosphate, aluminum phosphate, all of them are miscellaneous drug or household drug. Household drug. So they come in the miscellaneous category. This is very important regarding the classification. Zinc phosphide and aluminum phosphide are used as pesticides to kill pests. So our learning objective specifically for the cannabis indica will be, first we need to know four types of it. What are the signs and symptoms? Fatal dose and fatal periods, medical legal importance, and the most important is run amok. What is run amok? It's come mostly in the exams, so we should know about this. This is the medical legal aspect of uh, cannabis indica. So we also call that Indian ham, daga, or hashish, and all of the part are poisonous. It's a drug of addiction, and this also used for the hypnotic and analgesic effect as well. This is the picture of the plant that's used inside indoor. This is the plants of the cannabis indica. Now let's talk about the active principle. The active principle is the cannabinol. It's very important. The active principle for the cannabis indica is cannabinol. They are come into two different types. This is THC and CBD. So the neurotic effect is come from the THC. However, the anxiolytic effect come from the CBD. The interesting thing is it's fat soluble and it stimulates the central nervous system, and it's absorbed from both digestive system and respiratory tract. It comes in four different forms, that is the bung. The concentration of the bung and the active principle is 15%, and it's the least potent. Highly used for the recreational purpose, and this is majun when it's mixed with the sweet meats, so it called as majun. The ganja is the one that has the active principle for almost 25% of the cannabinol, and most of the time it's mixed with the tobacco or smoked in the pipe. The next one is church. It's also called as hashish. This is the most potent form, and its concentration is almost from 25 to the 40%. It's smoked with the tobacco, and it has a very specific dark green or brown color. Most of the time, they are stored inside the cell of the human body, so they release slowly throughout the time and act as a release capsule because they are fat soluble. So single dose can affect for as long as 7 days. Let's talk about the sign and symptom. It has a very high euphoric effect at first, and then later on it's lead to the very deep sleep. The person become very pleased with himself and he is well-being, cheerful and talkative. The appetite highly got increased and his food with a great interest. With the large doses, when the dose become very high, the loss of perception occur. He doesn't know about the time or place where he is. He has some visual hallucination that lead to the very high deep narcosis, which is characterized by giddiness, confusion, and ataxia. There might be the tingling or numbing sensation at the extremities with a deep sleep for almost 6 to 8 hours, which wake up fully recovered. This rarely drowsiness may followed by the coma or collapse. Rarely that happen that a person who has been asleep and then it leads to the coma or collapse. However, respiratory paralysis can occur, and the great thing is it can lead to the hashish insanity. Let's talk about the fetal dose and the fetal period. The fetal dose is 2 milligrams specifically for church is very 2 gram for church is very little amount per body weight. However, for the ganja that is the 8 gram per body weight and bhang is that is the 10 gram. So the most potent with a higher concentration is right there. Death may occur up till the 12 hour in acute poisoning. Let's talk about treatment and the postmortem appearances. The treatment will be the gastric lavage with strong coffee and tea for the artificial respiration, saline purgatives, and symptomatic treatment. Signs of asphyxia are highly found inside the uh, postmortem appearances. We will be discussing the sign of asphyxia in the asphyxia chapter. What the medical legal aspect? Highly accidental. Most of the time, people use this as recreational parties, so they got it highly dosed and that lead to the death. However, most of the time, people mix it with the brownies and chocolates or in cigarette for the euphoric effect, and people use it for the stupefying poison. Do remember, this is also stupefying poison for performing some robbery, kidnapping, or any foul play. This is high importance because this is from the International Drug Alliances, has come under drug addiction category, and a person who has been addicted to such thing might be prone to the road accident or violence or crime. After that, ganja is taken straightly to nerve to perform some special bold, like somebody want to kill some person, they take the ganja to perform some criminal activities. These are the medical legal importances. Now on top is run amok. It's a very interesting story. In the run amok, a person who has been used it continuously or for the first time has a very high desire to kill someone. First, he want to kill a person who has with the real enmity is, जिसके साथ उसकी अपनी दुश्मनी होगी, उसी को सबसे पहले मारेगा and later on anybody who come in the way, he's try to kill them. At the end, he will feel a high guilty, or due to the guilt, he will commit suicide or might hand it over himself to the police. It's with a very important medical legal importance for the run amok. Now, the next topic is salicylic acid or the aspirin. We highly discussed that in the pharmacology. So, this is a physical property of the salicylic acid. It is odorless and crystalline solid with a sweetish acid taste. We use the aspirin for the skin diseases to reduce the pain, fever, and inflammation. What are the important preparation? These are the sodium salicylate, methyl salicylate, we call that oil of wintergreen, or acetyl salicylate, which are the real aspirins. This is the crystalline structure of the salicylic acids. We use it in medicine and we use it for the different aromas. The clinical feature are they are highly absorbed only when they are using therapeutic dose from the GIT. However, in the overdose conditions, its absorption become very slow. The reason is the plasma concentration saturate to it. What it do, it responds highly stimulate the respiratory center inside the medulla, due to which it lead to the respiratory alkalosis, and to compensate this respiratory alkalosis, the body need to dehydrate, and due to this dehydration it will lead to loss of sodium, potassium, water, and specifically lead to the hypokalemia. This is a very important feature of the aspirin, that they leads to the hypokalemia. The medical importance and sign and symptom for that are the mechanism of action for that is it interfere with the carbohydrate, lipids, protein, and amino acid metabolism. Specifically, it lead to the hyperpyrexia, sweating, nausea, vomiting, and it's lead to the salicylate jacks. What are these? These are the excitement, tremor, delirium, convulsion, stupor, coma, tinnitus, deafness, and it might lead to the coma as well. These all are the sign and symptoms, or might lead to the very high doses salicylate jets. It's also leading to the proteinuria, sodium and water retention, and tubular necrosis and hypoproteinemia. This is very important. Now, the next topic is aluminum phosphide. Regarding the aluminum phosphide, I want to tell you that it's not poisonous by itself. It's not poisonous by itself. Aluminum phosphide and zinc phosphide, these are both the same. There's nothing difference between them. They work same, their mechanism of action is same, and they are not poisonous by itself, but still wherever we see them, there will be a very high uh, cautious warnings regarding this. So let me tell you what just happened. In the long case, when the aluminum phosphide ALP react with the water, it leads a very dangerous gas. We call that phosgene gas, PH3, phosphine gas. Now the all dangerous effects that is coming from the phosphine gas. Alright? So by itself, aluminum phosphide is not dangerous until unless it come in contact with the moisture. How it's going to come in contact with the moisture is human condition. It will go inside the stomach and lead to the acid combination. Whenever it will combine with the acid, it will lead to the discharge of phosphine gas PH3. And now this gas will have all the toxic effect that's leading to the aluminum phosphide, right? On coming in contact with the moisture, aluminum phosphide liberates phosphine gas, which is a very toxic. Now, what just happened? Physical properties and absorption is it has a very foul garlic odor. Where did we discuss the garlic odor previously? We talked that in organophosphorus poisoning, OP, where the phosphates are present, and then we discussed specifically in phosphorus as an irritant. It has also garlic odor, and now again in aluminum phosphide, the garlic odor will be specific, right? All of them are coming due to the presence of the phosphide. Mechanism of action is again I have previously discussed that due to the ingestion of the ALP, aluminum phosphide with the HCl present inside the stomach leads to the phosphine gas. Now this will greatly affect the cytochrome system inside the mitochondria. Inside the mitochondria, continuously oxygen is building up, combining with the uh, different ions, leading to the formation of ATPs. And this ATP is the currency unit for the human body. Now, if that's stopped, it means cellular respiration is stopped. All of that occur inside the cytochrome. Now, it will combine with the cytochrome oxidase. Cellular hypoxia will occur and the organ will highly damage along with the electrolyte imbalancement. So this is why that's highly used for the rodenticide. Whenever rodenticide use it, due to the moisture, the phosgene gas will release inside their body and they will lead to the cellular oxidation or cellular respiration will got stopped and they go outside of the home for higher concentration of oxygen and die there. All right. This is the theory behind most of the advertisement that present for the aluminum phosphide is that our product make the pesticides kill outside. Reason behind this due to stopping of the cytochrome oxidase system. So what will happen if that go inside the human body? It's highly disastrous. Okay, aluminum phosphide cause human death. It's used in pesticides and most of the time it has a very high warning. Same in Pakistan, it is used in different pesticide products. The fatal dose is 150 to 500 milligram. It's very little and highly lethal from 1 to 6 hours. In the cases of inhalation, it's lead to the exposure, mucous membrane irritation, acute respiratory distress, dizziness, easily fatigability, tightness in the chest, nausea, vomiting, headache, and diarrhea. None of them are specific. Same, it will lead to the ataxia and severe toxicity, numbness, paresthesia, tremor, diplopia, all of them will be present along with the jointers, ARDS, acute respiratory distress syndrome. Of course, they will present in the severe toxicity along with the convulsions. So where will that most of time face? It faces by the accidental inside the home as well as by the farmer inside the field. Now, if somebody ingested it, so might to severe effect might cause in GIT, cardiovascular, respiratory, hepatobiliary, renal, and CNS shock. The diagnosis is specifically on the history that a person was working on the field or might be drink something that is in near range for the uh, places where people keep a lot of grains or anything. So, the rodenticides might be taken accidentally. The foul smell coming from it. So, which smell will come from it? Garlic odor. Why the garlic odor? Because of the presence of phosphate. Okay. So, clinical manifestations might also show the sign and symptoms. Eventually, we will go for this silver nitrate paper test. What is the silver nitrate paper test? We will take the uh, gastric, we will take the blood or the gastric content and put it on the silver nitrate paper. It will turn it into the dark color. So, two methods, I will take the gastric feeds or take the uh, breath, put it for the silver nitrate and wait it for the color darkening. If it's dark, so we can say that it contains the phosphates compounds or specifically aluminum phosphide. What is the management? Management is come under the three categories. This is the most dangerous thing. So first of all, we need to reduce the absorption of the phosphine gas that's continuously producing inside the stomach. We talked about the mechanism of action, so go for our friend gastric lavage. Then activated charcoal is a very good absorbent, antacids, and liquid paraffin. These are the things that will reduce the absorption. Now we need to reduce the observed phosphine gas. All right, that is observed by itself. So magnesium sulfate. This is the antidote specifically used for the observed phosphine gas. All right, because it has leads to the hypomagnesia. Now, we need to excrete the phosphine gas that's present inside the bodies by increase the hydration, regular perfusion through IV, dialysis, and treat the shock and arrhythmias and metabolic acidosis that produces an asymptomatic. The mortality rate specifically depend upon the dose that has been taken as the freshness, either that was very fresh or that was very old, present for years and years long ago, the arrival inside the hospital, the duration and severity of the shock, the vomiting, and of course, non-availability of the antidote. What will be the post-mortem and medical importances? The post-mortem will be the petechial hemorrhages present inside congestions through all mucosal membrane, intense garlic odor. Do remember that. Stomach show mucosal shading. What will be the medical importances? We talked about that. This is the suicidal from family or homes, or maybe from the fields or farms, might be taken accidental by children, rarely homicidal because of this specifically garlic odor. Now, the phosphate is the same story like that of the aluminum phosphate. All right, rat poison, dark gray crystal powders, and again it will combine with the HCl leading to the phosphine gas. 4 to 5 gram is required. It's a very high concentration compared to the aluminum phosphide, and this time period is quite bigger than that of aluminum phosphide. Clinical manifestation complete like aluminum phosphide and caused by the respiratory failure due to the stopping of cellular oxidation inside the cytochrome system. ATP stopping will occur, right? This is zinc phosphide specially used for the rats. Black color powder, highly poisonous. The treatment specifically supportive. Postmortem appearances show hemorrhages, appearance of all GIT mucosas, and might be covered with the black fine powder. Garlic odor again present. The cherry red stomach will be present, and lungs show hyperemia and edema. other organ consumption. That's it. If you have any question, please do ask me. Thank you so much.